Welcome to the Ohio Hospital Association's Healing Ohio Together ceremony, a recognition of Ohio's hospital caregivers. I'm Tracy Townsend of WBNS TV. It really is an honor to be a part of this year's recognition ceremony. The Ohio Hospital Association's awards were created to honor stellar service, exemplary performance and leadership, and excellent personal and organizational accomplishments within the Ohio hospital community. The annual recognition of hospital caregivers and leadership achievements is a time-honored tradition, and this year we are combining both programs to honor all Ohio hospital heroes. For those of you who may not know the Ohio Hospital Association's history, it was the first statewide hospital association in the country. Established in 1915, OHA has represented one of the state's most valuable and vital industries for more than 100 years. Guided by a dedicated team of healthcare and policy experts, clinicians, and business professionals, OHA strives to fulfill its mission every day to collaborate with 245 member hospitals and 15 health systems to ensure a healthy Ohio. Well, now, I would like to introduce OHA's president and CEO, Mike Abrams.
Thank you, Tracy, and welcome to our recognition of the incredible heroic work by Ohio's hospital caregivers during this once-in-a-century pandemic. In previous years, I would have been speaking from a stage at our annual meeting in a hotel ballroom, recognizing the accomplishments of individual caregivers and hospital leaders. That event is one of the highlights of my tenure at OHA, and I hope we're together in person again soon. Ohio hospitals are cornerstones of the communities you serve. More than 250,000 Ohio hospital caregivers have been battling the COVID-19 virus while compassionately taking care of the everyday needs of our fellow citizens. And today's program is about recognizing all of you. Our hospital caregivers have displayed ingenuity and devotion as you took on many new roles during the pandemic. You became COVID testers. You became logistics experts, standing up mass testing and vaccination centers. You sourced vital equipment from around the globe. Some of you boarded planes in the early days of the pandemic to staff ICUs in New York City and other raging hotspots, putting yourselves at risk as scientists were just beginning to understand this novel virus. Innovators throughout Ohio hospitals began modeling the virus spread to prepare for Ohio's own hotspots, and several hospitals became trial sites for vaccines and COVID therapeutics. Since March of 2020, our heroes have cared for more than 81,000 COVID patients in Ohio hospitals, including nearly 11,000 who required around-the-clock intensive care. And as we all know, we're still coping with this virus in our communities as we work to increase our vaccination rates. The innovation continues as well. Our member hospitals have created specialty practices to care for patients with long-term COVID conditions. One hospital is testing a breathalyzer instant COVID test. Tracy has shared with you how today's program will differ from our previous annual recognition event. Our goal with this program is to say thank you and recognize the statewide impact and accomplishments of the more than 251,000 hospital caregivers, hospital leadership, and the special role of our COVID response leaders. Tracy, back to you to present our leadership awards.
Each year, the Ohio Hospital Association presents 3 healthcare leadership awards to honor outstanding individuals and organizations whose achievements have enhanced and brought honor to Ohio hospitals. Our first leadership award presentation is the Donald R. Newkirk Award. This award is named for the man who led OHA for 27 years, from 1962 to 1989. The award is presented to an individual with multiple years of healthcare service who has made a significant impact in his or her hospital, the local community, and across the state of Ohio. This year's honoree is David Blohm, retired president and CEO of Ohio Health. Beginning his career with Ohio Health more than 35 years ago, David built the region's largest healthcare system and one of the nation's top 5 largest health systems by making healthcare more accessible. A focus he's never lost and a commitment that has changed the face of Ohio health and healthcare delivery to patients locally, statewide, and nationally. His innovative thinking grew the system in ways that also benefits employees and the local economy while creating cutting-edge services that save lives. David grew Ohio Health by creating both a culture that's focused on serving the community, creating access, and establishing standard practices and efficiencies around medicine and patient care. That culture now permeates the system's 11 urban, suburban, and rural hospitals and the more than 200 ambulatory sites serving patients in 47 Ohio counties. David also understood that competing hospitals in Central Ohio could collaborate to provide better care across systems. In 2008, he helped create the Central Ohio Hospital Council, which brings together Mount Carmel Health System, Nationwide Children's Hospital, the Ohio State University Wexner Medical Center, and Ohio Health. From blood supplies to health information exchanges, community health needs assessments, and infant mortality, the council develops big ideas to cooperatively address pressing healthcare issues. Congratulations, David Blohm. Our next leadership award is OHA's James R. Castle Distinguished Service Award. This award bears the name of OHA's retired president and CEO and honors an individual whose professional attainments embody qualities of an outstanding leader or mentor for service to the community or other special achievements. This year's honoree is Michael Winthrop, retired president and CEO of the Bellevue Hospital. Winthrop has worked in the healthcare field for 42 years and served 32 years providing visionary leadership to expand health services, technology, and facilities at the Bellevue Hospital. Michael's compassion for people and for local healthcare directs and drives the Bellevue Hospital to do what is right for the community served. He has guided the hospital through some of the most critical times and helped it grow into the quality facility it is today. He began his career as president and CEO of the Bellevue Hospital in September of 1988, thinking it would be a stepping stone in his career. But he couldn't predict the deep connection he would form with the rural Ohio town, its residents, and the hospital. When Michael arrived in Bellevue, specialty physicians on staff were limited. The small hospital was regarded as a Band-Aid station. His goal was to create a solid community hospital, and he worked to build relationships to make that happen. Michael's philosophy was no matter the need, he wanted residents in his community to turn to the hospital. One significant way he accomplished this was by setting up a clinic for patients who had no access to established health care. This clinic pulled in residents from neighboring communities and served their needs at low or no cost. His forward thinking drives the Bellevue Hospital to do what is right for the communities it serves. That vision is to always look to the future while maintaining its mission of caring. Michael, who retired in August, has created a legacy for the Bellevue community, one that will continue well into the future. Congratulations, Michael Winthrop. Our final leadership award for tonight is the Dr. Eli Crew Community Service Award, named after OHA's first president. This award recognizes an individual or organization who has served as a friend to hospitals and health systems and whose support of the healthcare industry reflects the public interest. This year's honoree is Sister Doris Gottemuller. Sister Doris is chair of Bon Secours Mercy Ministries, the sponsoring organization of Bon Secours Mercy Health, and a member of the Bon Secours Mercy Health Board of Directors. Sister Doris is an internationally recognized thought leader who excels at guiding health system leaders and staff in understanding their commitment to safeguarding the dignity of all people as they provide high-quality, accessible health care services to all. More than 40 years ago, Sister Gottemuller began working to ensure that as healthcare delivery evolved, Catholic community hospitals would survive and thrive. Her vision and persistence set the stage for Catholic health systems to expand their ability to provide high quality, affordable health care for millions of patients each year while furthering their missions of service to vulnerable and poor people. In the 1980s, Sister Doris began the difficult task of convincing CEOs of standalone Catholic hospitals to join into one system. For 2 years, she met with hospital CEOs in 3 states. Though initially resistant to giving up their autonomy, the CEOs were convinced by Sister Doris that their hospital's ongoing ability to support patients and their local communities would be strengthened by combining their investments, achieving savings through shared services, and implementing a board of directors consisting of national leaders. Through her efforts, a multi-state system of 11 hospitals and 35 facilities was established that would, in time, become Bon Secours Mercy Health, Ohio's largest health provider and the 5th largest Catholic health system in the U.S. As a result of Sister Doris's foresight and the changes she championed, Mercy Health serves communities across the state, including Toledo, Lorain, Youngstown, Springfield, Urbana, and Cincinnati. Congratulations, Sister Doris Gadamoller. Congratulations to all of the leadership honorees. COVID-19 has permeated every part of Ohio's hospital community. The pandemic launched unparalleled levels of collaboration and strength. Interdisciplinary teamwork has been paramount to battling this virus. At the beginning of the pandemic, Ohio was divided into 3 zones to better manage the flow of patients, supplies, and equipment throughout the different phases of COVID-19. Now, let's go to Gallipolis, Ohio, to hear from Dr. Michael Canady, President and CEO of Holzer Health, about how the zone structure helped his health system serve southeastern Ohio.
Hi, everyone. My name is Mike Canady. I'm the Chief Executive Officer for Holzer Health System and a current member of the Ohio Hospital Association Board. I was honored when they asked me to provide some comments about the impact of the zone system on Ohio. But I quickly realized it's an almost impossible task to explain in a few short minutes how important the zones have been for the pandemic and helping each other to provide the care that we need for our patients. So I thought I'd start with a story, a true story. Early on in the pandemic in southeastern Ohio, we didn't see much COVID. We saw some in the fall last year, and we had a pretty significant surge for us. We approached having 50 patients in our healthcare system. It stretched us, but it didn't break us, and the vaccines came along and allowed us to mitigate that surge, and through the spring we didn't see much. But this last surge that we're now coming out of, hopefully, stretched us to the near breaking point. We had patients that we were having to board in our emergency departments. Our ICU was full. Our entire med-surg floor was turned into a COVID unit. And we ran out of things suddenly at times because we had these surges that just came at strange times. One weekend day, we realized that we were going to run out of BiPAP machines. A quick call from our Chief Nursing Officer to Andy Thomas, our zone lead, resulted in a return call within a half an hour. We've got what you need, come get it. So within 4, 5, 6 hours, we were able to get the equipment we needed to provide the care that we needed to provide to the patients that were sick in our emergency room. This is just one example. I could give many, but I will say there's been no playbook for this process. The zone concept was in place, but without the leadership that we got from our 3 zone leads, Dr. Lofgren, Dr. Thomas, and Dr. Wiley, we couldn't have done what we've done. The one thing that brings it home for me is a comment that my Chief Nursing Officer made this morning when I was discussing this with her. The one positive thing that we've gotten out of the pandemic is the zone process. I hope we continue to have zone meetings. The zone concept and the leadership from our zone leads has allowed us to collaborate, to share resources, and to provide the care that we need to provide to the patients that we have across the state. I can't tell you how valuable it has been and will continue to be. Thanks for the opportunity to share this quick story. I hope you have a great evening. Thanks.
Thank you, Dr. Canady. This year, OHA is presenting a new award to honor the 3 zone leads and their work responding to the pandemic. Now here is Mike Abrams to further expound on this new honor.
When I reflected on the monumental work of our hospital community to respond to this pandemic, one element that was critical to our statewide response was the role of the 3 physicians who accepted the immense responsibility and role as the zone leads, directing all aspects of response within their sector of the state. And they continue to perform this vital role while maintaining their leadership roles within their own health systems. That's why OHA this year is presenting a Presidential Award of Merit to recognize the outstanding and ongoing work of Dr. Robert Wiley of the Cleveland Clinic for the Northern Ohio Zone, Dr. Andy Thomas of the Ohio State University Wexner Medical Center, who directs the Central and Southeast Ohio Zone, and Dr. Richard Lofgren of UC Health, who's leading the Southwest Ohio response. The state is divided into 8 emergency response regions, but those were created to handle natural disasters or mass casualty events likely to be centered in one area. As we know, COVID required a more unified statewide response. The map was reconfigured into 3 zones, and the work of emergency management, hospitals, public health, community clinics, and nursing homes were coordinated through the zones. Each of our honorees will be receiving a specially commissioned piece of art that symbolizes the collaboration and unified work within and between the zones. Tracy, let's learn more about each of the areas and their leaders.
Zone 1 includes the northern counties in the state and is home to 5.5 million Ohioans. Zone 1 is led by Dr. Robert Wiley, Chief of Medical Operations at Cleveland Clinic. Let's go to Cleveland to hear from Dr. Wiley.
I accept the recognition on behalf of the many caregivers who have worked and continue to work tirelessly during the COVID pandemic to ensure the safety of all Ohioans. I would like to thank the governor, ODH, and OHA for organizing and supporting the zone structure. Zone 1 contains 5 of the 11 million residents in Ohio, and our colleagues in Cuyahoga County and the surrounding counties all pulled together to share ideas and resources. But the most important thing we did was to balance the load across the zone during local outbreaks. This included consulting on each other's patients, sharing medical supplies, and transferring patients when necessary. The zone meetings hosted by OHA with Amy Andrus and Mike Abrams, and the ODH and my 2 associate zone leads, Rick Lofgren in Zone 3 and Andy Thomas in Zone 2, were particularly important coordinating the effort in Ohio. One of the innovations we are proud of is with university hospitals and Case Western Reserve University. Jointly, we developed a geospatial analytic platform that can serve as an early warning system to recognize unusual patterns of disease and allow us to intervene more effectively, and we certainly want to continue that into the future. The health systems, OHA and ODH, have come a long way as partners. We want to preserve the working relations in the future to benefit all of the residents in Ohio. Thank you.
Zone 2 includes central and southeastern portions of the state and is home to 3.3 million Ohioans. Zone 2 is led by Dr. Andrew Thomas, interim co-leader and chief clinical officer, the Ohio State University Wexner Medical Center. Let's hear now from Dr. Thomas in Columbus.
Good afternoon. I'm Andy Thomas, Chief Clinical Officer and Interim Co-Leader for the Ohio State University Wexner Medical Center. It's really a pleasure to be here today to accept this award on behalf of over 30,000 faculty, staff, and learners at the OSU Wexner Medical Center who've been on the front lines during the COVID pandemic. I'd really like to thank the OHA staff for all of their hard work during this last nearly 2 years. The data they've been able to provide, the way they've been able to convene groups of experts to really get us to best practices across the state, the way they've been able to collaborate with those in state government has been outstanding and a benefit to all of us. I also would like to thank Bob Wiley and Rick Lofgren, my fellow zone leads. We've been on the phone with each other multiple times per week at 6:30 in the morning, really dating back to March of 2020, and their partnership has made this work a lot easier. Really, though, my thanks go out to the 40 hospitals and health systems across 36 counties in Zone 2. The collaborations that we've been able to build, whether it's in sharing PPE, sharing best practices related to remdesivir, related to vaccine programs, related to monoclonal infusions, and best of all, the collaborations we've been able to do to move patients between hospitals, what we call lateral transfers, to make sure that the right patient was getting the right level of care at the right time across our zone. We built collaborations between hospitals that have always considered themselves competitors and frankly didn't talk that much with each other. We've built, though, a new system that I think will continue on for years to come. I'd also like to thank the staff at COTS, the Central Ohio Trauma System, Jody and Kelsey specifically, but the entire team at COTS for all they've done to support me in my work, but to support each one of the local hospitals as well as local health departments and nursing facilities across Zone 2. The collaboration we built, thankfully, to open the convention center was never needed, but the work of my colleagues at Ohio Health, Mount Carmel, the county, from Franklin County, as well as the Central Ohio Trauma System has been outstanding. Last, I'd really like to thank the Ohio National Guard. They've done so much to support so many of us across this pandemic. General Harris and his team were always there to take a phone call, to think through a problem, and I can't thank them enough for all of their hard work and their service to our nation. Once again, thank you on behalf of those at the OSU Wexner Medical Center and across Zone 2 for this award. Take care.
Zone 3 includes the southwestern counties of the state and is home to 2.9 million Ohioans. Zone 3 is led by Dr. Rick Lofgren, President and CEO, UC Health. Now let's go to Cincinnati, where Dr. Lofgren has prepared remarks.
Hello, I'm Rick Lofgren, President and CEO of UC Health, and the chair of the Ohio Hospital Association Board of Directors. Since spring of 2020, I've also served as Zone 3 lead for Southwest Ohio's operational response to COVID-19. At the onset of COVID-19, there was so much that our healthcare community didn't know. How many patients could we expect? Did we have enough PPE? How long would this last? I remember a meeting at the governor's mansion in the early days of the pandemic. A dozen leaders from across Ohio gathered in a conference room to discuss the impact on Ohioans. It was so early in the pandemic, we didn't wear masks. We didn't know yet that this would become the most important tool in combating the spread of the coronavirus. I remember driving home that night and thinking about PPE and ventilators and what it would take to get the systems we needed in place to serve our community. The zone structure implemented by the governor not long afterwards was invaluable in helping our healthcare community confront our shared enemy. We became collaborators, not competitors. Within our region in Southwest Ohio, we took a regional approach to tackling shared issues such as PPE, staffing, preparedness, testing, and vaccinations. And we were guided by three objectives. First, protect our people. Second, ensure that everybody in our community had access to quality health care. And finally, share information collaboratively. The zone structure also allowed us to share information and learnings with our colleagues across the state, improving information and care for all Ohioans. Once the vaccines to COVID-19 became available, the zone structure also helped streamline the dissemination of these precious resources. As I look back over the past 20 months, I am proud of how Ohio and Southwest Ohio worked collaboratively to confront the shared enemy. And I thank the governor and my colleagues across the zones for their leadership and their collaboration.
Congratulations to the Presidential Award of Merit honorees. Now, I'd like to introduce Governor Mike Dewine to share his thoughts on the incredible work of the zone leads.
Hello, I'm Ohio Governor Mike Dewine. It's my pleasure to be able to participate in this event today. Thank you all for your selfless work throughout the COVID-19 pandemic. From clinicians to support staff, you've endured a once-in-a-lifetime health crisis and answered the call when Ohioans needed you. Thank you so very much. Ohio is renowned for our world-class medical institutions. Today, I want to recognize three leaders who committed themselves early on to getting Ohioans through this. Dr. Richard Lofgren from UC Health, Dr. Andy Thomas from the Ohio State University Wexner Medical Center, and Dr. Robert Wiley from the Cleveland Clinic answered the call, joined together with us to develop a statewide healthcare infrastructure network. In fact, literally, we've had hundreds of early morning calls, spontaneous, unscheduled calls throughout the pandemic. It's been a real pleasure to work with them. And I've gotten to see what amazing pros they are. This unprecedented partnership ensures that providers across the state have the supplies and resources they need while ensuring patients are at the appropriate place to receive the best care. This extraordinary partnership brings the state's health systems together to serve Ohioans as a team. Dr. Lofgren, Dr. Thomas, Dr. Wiley have sacrificed time away from their own doctors, their own hospitals, their own families to lead this team. They've ensured that providers in their respective regions that were running short on PPE receive supplies. They've made certain the patients needing treatment could go to a hospital with the resources to care for them. And they've helped address staffing concerns. Most of all, as the virus evolved, they adapted rapidly. They embody the spirit of Ohio in this together and have weathered this pandemic as partners. Mike Abrams and the Ohio Hospital Association certainly supported their work. And Amy Andres, as the facilitator, also really deserves our appreciation. While continuing with their day jobs, the doctors have created a legacy that will outlive this pandemic and better position Ohio for whatever the future holds. Our state is better because of their work. Our healthcare infrastructure is stronger. Their work has eased suffering and saved lives. Let me join my fellow Ohioans and simply say, Dr. Lofgren, you're amazing. Dr. Thomas, you're incredible. Dr. Wiley, you're truly outstanding. And we thank all of you so very much.
Thank you, Governor Dewine. Over the last 20 months, COVID has challenged hospital caregivers who have heroically risen to the occasion. The over 250,000 hospital caregivers across the state have provided compassionate care and are leaving lasting impressions on patients and their families. Don Cox and his wife were hospitalized for COVID-19 last November at Fairfield Medical Center. Don is one of those patients who was left with a lasting impression from his hospital caregivers. Let's hear from him now.
My wife and I were very cautious about COVID, and about this time of year, maybe mid-November, Connie started feeling bad. We had her tested and she tested positive for COVID. The next day, we had to call a squad for her. Unbeknownst to me, at the time, I too had COVID. The next day, the squad brought me in also. I was in ICU at first, and then they brought me down to the COVID unit, and they said that I would be right next door to my wife. And I thought, well, that'd be great, you know. Unfortunately, we were again quarantined, and we didn't see each other. When a nurse would come over to my room, she'd say, I just left Connie, and she said to tell you she loved you. And she would do the same back, or the other nurses would. And it was just, it was a huge help. It was like we were their only patients, but I could look out onto the ward, and it was just room after room after room after room after room, and it was overwhelming. A friend of mine, Dr. Doug Pope, who's a hospitalist here, he's the one that told me about Connie, and I remember we just hugged. It was a horrifying experience, but the healthcare workers certainly made it bearable during and after. After I got out, it continued with the nursing staff and with the doctors of Fairfield Medical Center, and the fact that they would call and check on me and see how I was doing, and if I had made arrangements for my wife's funeral, I was more than extremely proud of my hometown nurses, healthcare workers, the doctors. I would think that she would be more than grateful for everything that was tried. I know she feels that everything that could be done was done for her. If I were to say one thing to the healthcare workers, it's I apologize for some of the grief you've taken. Anybody that gives you that grief has no idea how hard you worked or how much you put your lives in peril or your family's lives in peril or anything else. I mean, you are the unsung heroes of the COVID. I'd say keep your heads up high, be proud of the job you've done, and may God bless all of you.
Thank you, Don, for sharing your powerful story. In 2015, the Ohio Hospital Association established the OHA Healthcare Hall of Fame in celebration of the association's centennial year. The prestigious award honors men and women who have made extraordinary and lasting contributions to the healthcare industry. 8 healthcare visionaries and leaders are honored with the well-respected distinction, and their recognition plaques are prominently displayed in the association's boardroom in Columbus. Mike Abrams will now announce the 2021 inductee.
The theme for this recognition program is Healing Ohio Together. All 250,000 Ohio hospital caregivers were needed to respond to the physical and emotional needs of Ohioans this past year and to support each other on the front lines. And you remain on the front lines today. We created the OHA Healthcare Hall of Fame in 2015 as part of our centennial celebration to honor men and women who've made extraordinary and lasting contributions to the healthcare industry. Through their leadership and unyielding commitment to bettering outcomes, Healthcare Hall of Fame inductees worked to reform healthcare delivery for Ohioans, transform clinical best practices, advance health and wellness, and improve the patient experience. This year, we're inducting the Ohio hospital workforce, the more than 251,000 Ohioans we're proud to call hospital caregivers, into the Hall of Fame. The Hall of Fame display is in the OHA offices in Columbus. We'll be installing this plaque to recognize in a permanent way the induction of all Ohio hospital caregivers. We'll be making replicas of this plaque available to our member hospitals to commemorate as they see fit. If you're in Columbus, please stop by our office to see the Hall of Fame display. We'd like to congratulate you in person. On behalf of the Ohio Hospital Association, thank you for all you do for the communities you serve at your hospitals and for your role in healing Ohio together. Now I'd like to introduce the Director of the Ohio Department of Health, Dr. Bruce Vanderhoff.
Mike, thank you and the Ohio Hospital Association for taking a holistic approach to recognizing the work of all Ohio hospital caregivers during this critical time in our state's history. I join you in congratulating and recognizing Ohio's hospital caregivers who've worked tirelessly throughout this pandemic, caring for more than 80,000 hospitalized COVID patients, 10,000 of whom required around-the-clock ICU care. Thank you. I don't know if these are words you hear enough. I hope they are. But you deserve the eternal thanks of all your fellow Ohioans for your bravery and perseverance throughout this pandemic. I sing your praises, and while there may be times the last couple of years have felt like a blur, I want to remind you of the accomplishments that you've made during that time and of the lives that you've saved. First, in the early days of this novel virus raging across our state, many of you boarded planes and traveled to ICUs in other hotspots like New York City. Here in our home state, you used your ingenuity to create field hospitals to manage load balancing, all while maintaining the highest possible standards of care. You found new ways for patients and families to connect, facilitating, for example, video calls. You brought comfort and support to patients who needed it most. In some cases, your hand was the last they held, and your soothing voice the last they heard. You shifted your roles in the hospital, standing up mass testing sites across the state to help identify and isolate cases and share prevention methods. And those of you who aren't patient-facing also stepped up in more ways than one, doing everything you could to lighten the load on our doctors, nurses, respiratory therapists, and those involved in direct patient care. Everyone was asked to contribute, and you did. For that, we thank you. Almost a year ago, when the life-saving vaccines first became available, large teams of hospital caregivers planned and operated mass vaccination sites, and you were among the first in line to get the shot to protect yourselves and to keep those around you safer. By choosing to be vaccinated, you also helped to safeguard your patients, your loved ones, and showed your fellow Ohioans that the COVID-19 vaccines are safe and effective. Over these many months, dozens of hospital team members have graciously carved time out of their busy schedules to join Governor Dewine and me at many press briefings, helping to explain many complex issues like testing, mitigation steps, and vaccines. Despite the countless hours and the physical, mental, and emotional stress, you've continued to meet the everyday needs of the communities you serve while continuing to fight this virus. In short, you're heroes. This recognition event was titled Healing Ohio Together, an extension of Ohio's In This Together approach to COVID-19. Because it takes all of us and all of you, the more than 251,000 Ohio hospital caregivers, to help us heal Ohio together. You deserve this recognition. Thank you for all you do, and congratulations.
Congratulations and thank you to all hospital caregivers for your hard work and dedication to patients and your communities. The Hall of Fame plaques will be headed to your hospitals in the coming weeks. Once they arrive, take a picture with it and share it with OHA on social media at Helping Ohio Hospitals on Facebook and at Ohio Hospitals on Twitter. Thank you so much for tuning in virtually tonight. We certainly hope to see you in person very soon.